not my area. I don't know. Yeah. It's a throwback. It's their genes, genetics. So then melanin goes out the window and it's just genetics. Oh, great. So that's me. Let's canter through his presentation. So I'll thank my colleague, Dr. Evelyn Mensah, for these slides. So I had some slides made for today, and I thought, ooh, her slide looks better, so I'll just use hers. Right, so the first thing, are you able to see all the words on the screen, or is it too small? Cool. I can't. So how many of us have had a sight test at our opticians? Right. How many of us go to opticians every 2 years? Because those wearing glasses. Yeah. Right. At the end of this, your take-home message will be, find your optician. Fine. So we've got a sight test, and a sight test helps us to detect underlying conditions. So at your opticians, they're the only ones who can pick up diabetes, hypertension, glaucoma at a very early stage before you end up with me in secondary care at Moorfields having to have laser or surgery. So it's vitally important that you go to your opticians every 2 years. If you have glaucoma, you should go every year, especially if you have a family history of glaucoma. So say mom, dad, granddad. And the reason for that is glaucoma comes on at least 10 to 20 years earlier in the black population than it does in the white population. And it's more severe. And there is no symptoms. We call glaucoma the silent thief of sight, because you absolutely have no symptoms until you end up with vision, like a pinhole. So your visual fields, and then what glaucoma tends to do, it tends to reduce your visual fields with the eye pressure until you're basically seeing like a tunnel vision. And you won't know that's happening because your brain is quite smart, God made us, and it just makes up the environment. So it tells you that the road is clear when the bus 249 is coming towards you. So not good. So let's look after our eyes. So sight tests, we need to have regular sight tests every 2 years. Now, eat healthily. I know in the Seventh-day Adventist Church we push that quite a lot, lots of eating healthy. But we need to also remember that our grandparents were also correct in our green leafy vegetables. How many of us eat kale? Yeah. Kale, spinach, all of those dark green and bright colored vegetables, those have a lot of vitamins called lutein. And those lutein sits in the eye. That's the only place in the body it is stored and forms like a UV filter. Without that, that's like our natural sunglasses. Without that, you have lots of problems. So it's very, very important to eat that. Now, I know people tend to say use supplements. If you can afford to, fair enough. But a bottle of supplements is like £44. So which is better? You get some roughage with this one as well. Supplements, you don't tend to get roughage. But if you can afford it, go ahead. But your vitamin A, E, and C, your omega-3 fats, and then I've got here family history of macular degeneration. So we are always told that macular degeneration is a condition that only happens in white people. It doesn't. It happens in black people, it happens in Asian people as well. Not as frequently, but it does happen. And that's a condition where you get the sight-seeing cells in the middle of your eye dying, and you have to have at least 8 injections into your eye per year. So let's kind of avoid that and have our green leafy vegetables. Yeah? Good. So wearing prescribed glasses. How many of us went to the pound shop to get our glasses? How many of us, if you lose our glasses, still go to the pound shop to have a ready readers? I'm not judging, seriously. Now, if you don't do it yourself, please tell your friends and family as well, don't do the pound shop. The reason they're in the pound shop is they're there for a reason, because they're cheap and they're not good for your eyes. You need to wear prescribed glasses. Some people, there's a myth going around that if you wear glasses, it damages your eyes. Your eye was already damaged, that's why you got the glasses in the first place. So we always say, wear your prescribed glasses. What we tend to say as well, so think about this analogy. If you don't know what's wrong with your eyes, but you go and get a pound shop glasses, that means you don't have an idea about what's going on. It's like putting a plaster on an infected cut. You're just you're covering the wound, but not knowing what's going on underneath. So if you've got diabetes or any other condition going on at the back of your eye, and you put glasses on just to help you see better, you might see better in the short term, but you still have the damage going on at the back in the long term. So again, going to your opticians will pick up all of those conditions, give you the right glasses, and also refer you into where you need to be helped. Yes? Yeah. Yes. Because it strains your eyes when your eyes doesn't need to strain that much. Yes. Because where has your hands been?
When's the ideal time? When's the ideal time to start doing eye tests on children?
So they should have eye tests in school at the age of 5. And I have a slide on children. Can I wait until I get to that one?
Great.
Okay. Super. So taking regular breaks. So how many of us have PCs, laptops, mobile phones, tablets, iPads, Kindles? So we all have some sort of digital medium that we use. But how often do we take a break from it? Every 20 minutes? Every half an hour? Every hour? When the film finishes? Right. We need to look away every 20 minutes at a distance of 20 feet, so that's 6 meters, for 20 seconds. Why is that? When you are looking at something up close, your muscles are contracted. Think about sitting in that position for 4 hours without moving your legs, without moving your bum, without moving anywhere. Just sitting in one position for 4 hours. Can you do it? Without moving. Okay? What will be the state of your muscles afterwards? Would you be in pain when you get to walk? So why are you doing the same to your eyes? So every 20 minutes, look away for 20 seconds. Those of us who were born in Trinidad know what the word mako means. Look in the neighbor's garden. Look wherever you need to look, but look at a distance of 20 feet or 6 meters so that your eyes can the muscles can elongate and give your eyes a rest. It takes 20 seconds for your muscles to lengthen, and then you can look again. Now, in that 20 seconds that you're looking away, you need to remember to blink. And I'll go through a slide on why we need to blink as often, but blinking helps to refresh the tear film of our eyes, which is very, very, very important. So do I need to go through this here? Right, next slide. Wear sunglasses. How many of us got sunglasses on Primark? Okay. Most of our eye conditions are affected by smoking. Diabetes gets worse in the eye with smoking. Cataract comes on with smoking. Could be a risk factor. Not so much glaucoma. Age-related macular degeneration, again, affected with smoking. Because what smoking does in the entire body, it narrows your blood vessels. So everywhere you have blood vessels running can be affected. And that narrows your blood vessels, narrows the amount of oxygen and nutrients coming to your cells, and therefore it's doing yourself a disservice. So, just not good. Sunglasses. So, how many of us got sunglasses from Primark or Matalan or any of the lower end stores? Lower end, I mean just cheaper stores. Right. That's absolutely fine, but make sure it has a CE marking on it. The CE marking means that there's a proper UV filter on there. So not judging on price. I shop Matalan all the time. But yeah, it has to have a CE mark on there. If it doesn't, it's just going to be a stylish product, but nothing's going to be protecting your eyes. It's okay, we can't see this, quite small. However, those of us who drive, your driving vision needs to be something called 612. And that's a legal limit. If your vision is above 612, so above means anything going from that red arrow up to that big letter A, you need to have some kind of corrective glasses, contact lenses, or something of the sort. If you have diabetes and you've had laser treatment to the back of your eye, you have to report that to the DVLA, and the DVLA will then ask you to do additional tests. Because unfortunately, what we do to people with diabetes that have diabetic eye disease, we put laser spots to try and control the disease, but those kill the peripheral cells as well. So you can't see as well in the periphery. So you need to have tests to make sure you're safe to drive. So those of us who are able to go to the opticians, fine, but there are some people at home, our friends, relatives, family members, who are not able to go to the opticians. We can get them to come into us. It's a free NHS service. Just look online and we can ask them to come to the home to see our grandparents. And it's essential for for it to be done. Children. Yeah, I mean, I've got a daughter and I was like, what is she doing? Why is she so close to the screen? The younger ones, they always drift closer to television to have a look. It doesn't mean that their eyes are bad. It just means that they're curious, and that's good. But if their eyes begin to drift in, what we call a squint, or drift out, they need to be seen by a specialist. So your GP or optometrist can refer them in to us to have either patching or to have surgery. At age 5, they should, in school, have a vision test. Their school nurse would inquire. It may be different in different boroughs, but I know mine had hers at 5 when she entered reception. If the child has difficulty concentrating, you know how back in the Caribbean we say people have hard head? If you can't see, you're not learning, right? So therefore we need to investigate, why is it that they're not being able to pick up that information? Can they not see the book? Can they not see the board? Behavioral problems. How many of us always think about children sitting at the back of the class or troublemakers? But if they can't see, they have to occupy themselves somehow. So therefore, let us not badge our kids with behavioral problems or being, hard-headed or whatever. Let's look for the problem that's causing them to do that. It might be a sight problem, and we have lots of children complete turnaround once they got the correct glasses on. Now, very, very busy slide, but this is just to say that we've got one eyeball, or two. However, there are many different parts. And I was speaking to a patient about 2 weeks ago, and she was saying to me, I came into you for diabetes, but you're sending me somewhere else to do my cataract. Are you quacks? It's just one eyeball. What she didn't realize are different specialities within that one eyeball. So even though I can do back of the eye, somebody else does front of the eye, somebody else does the side of the eye, somebody else does the skin at the front of the eye. So there are many different specialities just in our eyeball. So if we do send you other places, please bear with us. We do know what we're doing. Lids, lumps and bumps. So what I'll take you through now is the front of the eye, so the skin, the eyelids, all the way back to the eye, and all the different structures and all the different conditions that can happen within the eye. So how many of us has had a sty or chalazion in the, yeah. What did you do for that? Yeah. Yeah. So what the chalazion, this little bump here on the child at the bottom is called a chalazion. And what it is just a blocked gland, a blocked oil gland that gets infected. So what we need to do and what we usually advise is lid hygiene. So you take a flannel, as warm as your hands can tolerate, in warm water, and put it onto the chalazion and leave it there for up to 5 minutes. And then what you do thereafter is you massage down, because you're trying to heat up the oil, get it to unblock and get it to press out and bring it out, and that's it. If it gets worse, sometimes you have to do a small procedure called lid surgery and just slightly cut it and then pull the material out. And it's fine, it's a day procedure. No. Massaging it out with a warm compress, massaging it out is fine. Now with lid hygiene, what we also do is you can take the same cool boiled water with a cotton bud and then run it along your eyelashes. Those of us who wear mascara, I'm guilty. Sometimes you don't clean it out properly. So therefore you take a cool boiled water, tip of cotton bud, and just go along your lash line, and that will help unblock your glands as well. Another condition I have on there is called blepharitis. Same treatment. What blepharitis is an overproduction of the oils, and it tends to appear on your eyelashes, looks like dandruff. Again, that's a very chronic condition. It doesn't go away. You know, there might be periods where it's dormant, but it always comes back. That, again, you have to have really good lid hygiene, warm compress, press the glands out so that your tear film will be good, as well as your appearance, because it can be very itchy, can be very sore. Another condition on the top two, we have something called entropion and ectropion. So don't remember the big words, but just remember the conditions. So in the top, your right, you'll see this person has their eyelashes turning in. Can you imagine having all those eyelashes sitting on your eye? And that's because their eyelid has just turned in. So that's a medical condition, and it needs to be taken out, because what it's doing there, it's scratching the surface of the eye. And the surface of the eye is a nice clear window. Can you imagine? Continual scratches will make it opaque or make it cloudy. So that needs to be seen to. The other person has something called ectropion, where their lower lids, and this tends to happen in elderly people as well, the lower lid turns out. So then they're always tearing, because the tears can't collect in that little V anymore. And then they always have dry eyes, so they always need lubricants. So those two things, we can have surgery for it. It's just a day procedure, and then they're back to normal. I've put on there basal cell carcinoma. We tend to miss a lot of these in black people, because it just seems to be like a normal mole. If you have a new mole that's growing, that wasn't there before, get it checked out. So that's blepharitis. As you can see, it's just collecting along the eyelashes. And the picture to the far left is where I have the little arrow, is the glands. And if those glands become blocked, that's when you have the problem. How many of us have had red eye? Back to your question about rubbing the eyes. That's what happens. So one is called bacterial conjunctivitis and one is called viral conjunctivitis. Who wants to guess which one is which one? So one produces a lot of water and one produces a lot of pus. Which is which? Which is the pus one? They're all conjunctivitis. Which is the pus one? Ding, 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 ding. And then viral is the one with the water. They're both highly contagious. When you go to your GP or over the counter, don't take antibiotics for viral conjunctivitis. It's not going to do anything. It needs to be the bacterial kind. But again, cleaning your eyes, lid hygiene, will get rid of it after about 5 to 7 days. Allergic to conjunctivitis. How many of us have hay fever? Yeah. Your eyes tend to swell up, but it just resolves on its own. You can get some antihistamine drops, some lubricants, and you'll be fine. How many of us have had this? At the front, yeah? Do you have high blood pressure?
No, I go into the front and I rub my pokes in my eye.
Yeah, that works as well. So when I was pregnant, my lovely daughter made me vomit every single day for 9 months. And that was the color of my eye for 9 months. Excess pressure, high blood pressure, that tends to happen. Now, it looks dramatic, but it resolves on its own, and it's absolutely fine. Now, if you have this bleeding in your eye, and you have cuts, bruises anywhere else on your skin, that's a problem. Why will that be a problem? Yeah, it's a blood issue. Yeah. So your blood might be thin, you might have some kind of blood disorder. So in the eye on its own, okay, we'll look at it. Anywhere else, plus this, you need to go and get yourself checked out. So we've moved from the front of the eye to the cornea. So the cornea is the clear window at the front of the eye. And it's not very clear, but you can see this little picture on the far left at the bottom is a tear film. The tear film has 3 components. The first one is like Velcro, sticks to the eye. The second bit is water. Now, this water layer has all the nutrients, has all the oxygen, and then the third layer is oil. Now, oil keeps water in, yes? But if those glands, those oil glands, become blocked and you have no oil, what's going to happen to your tears? It's going to dry up, it's going to evaporate. So that's why it's good to do your lid hygiene to keep the tear film healthy. Now, so dry eyes, any gritty sensation, any soreness, we can use drops them over the counter. The pharmacists sell them, I think it's 10 to 12 pounds for a bottle, as frequently as you can, as often as you can. That's fine. But the treatment for this is your lid hygiene to get that oil film back on your tear film. Right, how many of us wear contact lenses? How are you doing with that? Okay? No problems. Okay. So I'm not judging at all, but we usually advise people wear daily disposables if you can. Only because most of the infections that we tend to see with people with contact lenses is because they've either slept in them or they've come into contact with dirty water, whether it's just a splash or they've actually put the contact lens in their mouth to clean it out and then back into the eye. We tend to see stuff like this. So the top right is a normal eye, and then everything else, just one little white spot or any of those are corneal ulcers, and it's a medical emergency because what it's doing is actually eating into the eye, and then it can pop. So if you're wearing contact lenses, it's a ball. It's a ball. Balls pop, right? Yeah, so, and that little white line at the bottom there is pus collecting from that infection. So if you do wear it, just clean your hands, make sure you have proper hygiene once you're doing it.
Question.
Yes.
Would you recommend for people who wear contact lens to actually have other prescription glasses that they could use at nights rather than sleeping in the contact lens?
You're not supposed to sleep in it. We always tell you don't sleep in it. And why would you wear your glasses at night to sleep?
Some people do.
Okay. Now think about the contact lens, right? So I explained to you that the water layer in the middle has all your oxygen and nutrients. If you have a contact lens on, it's a hard piece of plastic at the front. How is your eye going to breathe at night? It's okay during the day, 8 to 10 hours, but at night. The breathable.
Should she wait?
Next.
Yeah,
I wouldn't wear them.
I know some people who play in like high collision sports, and some of them wear contact lenses, and sometimes because of the collisions and the hits they're taking, there's so much force that the contact lens comes out, and they put it back in. Is that should they be doing that, or should they, the second it comes out, just leave it?
How are they going to clean it before they put it back in? Are they going to put it in their mouth and then put it back in, or?
No, they just put it back in.
Yeah, and their eyeballs are still intact.
From what I know, yeah.
Yeah, no, that's not good practice. They're literally putting their sight in their holding the sight in their hands. It's not a good practice at all. Because why would you? Yeah. Yeah, we could talk about laser eye vision. I wasn't going to, but I could. So laser eye treatment is usually given for people who are short-sighted. It's given by lots of private companies. And the only thing I'll say to that is most ophthalmologists wear glasses. And let's move on.
Yeah.
What are the cause or the main diseases or causes of people going blind?
Very good question. So the four big things across the world, and it depends on country to country, due to socioeconomic factors and access to healthcare. So in the UK, the biggest causes of blindness is glaucoma and diabetes. In other countries, say sub-Saharan Africa or probably some parts of the Caribbean, it might be cataract. Other parts of the world, it would be AMD. So it depends on where you are, depends on access to healthcare, depends on ethnicity, different causes of blindness. But very good question. Age-related macular degeneration. Yeah, cool. So this one, uveitis, some people may or may not have had it. It's an infection at the front of the eye. People tend to be photophobic, so can't look at light. Very, very painful for about 6 weeks. And then we'll give you steroids usually to calm it down. It's an inflammation. If you don't have it, that's fine. But if you do, get into us quite quickly because the iris can stick to the lens and we don't want that happening. Lens. Right, so this is where we get cataracts. Now, the lens can become cloudy due to age, smoking, diabetes, drugs. So the main message is, if it affects your visual access, if you can't do your daily living activities, you can go and get it taken out. But you don't have to. If you don't want to, you don't have to. Up to you. It's a day case operation. So moving from the lens, let's go to the vitreous, the jelly at the back of the eye. Now, how many of us have floaters? Floaters. People over 40 have floaters. So that's just because the gel at the back of the eye, over time with age, becomes watery. And then you can just get bits falling off. So it's completely harmless. However, if you have any flashes and floaters, that's a problem. And we need to go into your opticians to get seen, because that means that your back of your eye is being pulled away. So back of your eye doesn't have any pain receptors. It just flashes. And that's your signal that something's going wrong. So pop into your opticians and they may send you in to have to be properly seen. So the retina. So the back of your eye has this tissue called the retina, and it's essentially like a camera film. Those of us who are old enough to know about camera films. It's like a film at the back of the eye. And as the light comes through the lens and it sharpens, it projects onto the retina. Now, we can have lots of conditions happening in the retina. At the back of the retina, where you have that little dark dot or little spot is called the macula, and that's where most of your sight-seeing cells reside. And we have lots of conditions happening there. So I mentioned AMD before, age-related macular degeneration, where it happens at the center of the eye. You can have two types. You can have the dry type, which is the picture on your top right, where it's just cholesterol-like deposits and it causes no problems. That's very early. But then you can also have the wet type, where you can see that lovely, well, I'll say lovely, but that blood clot that's just sitting there. And you can imagine if that's sitting on top of your sight-seeing cells and no light is coming through, so therefore you lose vision. But it also kills the cells as well. Diabetes. Right, with diabetes as well, it also tends to affect the back of the eye, and it happens in two ways. So think about a garden hose, and think about it having holes in it. Now, from the standpipe, along the hose, the pressure at the pipe will be the highest, and the pressure at the end will be the lowest. And if you have holes all along it, the pressure at the end will definitely be lower than the pressure at the beginning. Great. In diabetic eye disease, what tends to happen, the leakage happens because the high blood sugar eats away at the hose pipe, causing leakage. And that leakage is leaking out oxygen, leaking out nutrients, leaking out cholesterol. So that's one condition. Second condition, when you get to the blood supply at the end of the hose pipe, there's nothing really left for those cells at the end there, is there? Because all the oxygen and nutrients and everything else came out at the top. So therefore, the cells at the end of the hose pipe then says, well, I feel cheated, I need to be fed, and they grow their own blood vessels to feed themselves. And that's what the problem is, because those blood vessels are abnormal, and they can bleed, something similar to the macular degeneration picture, and then you have a big blob of blood in the eye. Now, going back to the leakage can also occur at the macula and cause a bubble. So another picture to think about is your carpet at home. You have your carpet and you have your underlay. The water tends to collect on the underlay and basically rot the underlay, killing all your cells, and then you have blurry vision. So, if you have diabetes, we just say look after it, look after your blood sugar, blood pressure, and cholesterol to avoid those two problems I just described. Any questions? Right. Yeah. So it's usually nice and flat at the back. So you know you have your sclera, that white bit. The white bit, yeah, that happens at the back as well. And the retina is usually flat. Now the vitreous in the middle, what I just talked about, the vitreous, the jelly bit, can contract and pull the retina away. So that's one way of it happening. It could also happen for injury, sports-related injuries. It just pulls the retina away. And how we fix it, you just put a laser and tack it back on, like laser glue, and tack it back on to where it was before. So, yeah. Sickle cell. So, how many of you know it can affect the eye as well as everywhere else? Yeah. So, if you know anybody with sickle cell in general, please encourage them to go to their opticians regularly to have a check. Because the same type of crisis that happens everywhere else in the body can also happen in the eye. And we've got some studies coming up because the first study of its kind to try and understand the causes and the vision that's lost by this disease is happening at Moorfields, hopefully in October, November, but there's nothing else being done on it before.
People who are albino, would that affect their eyesight as well?
Yeah. So the same way you need your UV filter, they don't have a UV filter.
Right.
Okay, glaucoma. I'll just rattle through this. So it's a group of conditions. It affects the optic nerve at the back of the eye. And as I explained before, the high eye pressure kills the blood cells, kills the cells in the periphery without you knowing, silent thief of sight, and your visual field goes from to that over time without you knowing. There's no pain, there's no symptoms. So only your optician can pick it up by doing that puff of air test. And then those of us who are over age 40 are supposed to have an eye test every 2 years anyway. But if you have a strong family history of glaucoma, please go every year. Yeah.
So what are the biggest main diseases for handing down of blindness?
Glaucoma, diabetes. But there's also some, which I haven't put in the presentation, on inherited diseases. So if you're missing a particular gene in your back of the eye, those as well, these people usually have normal vision during childhood, but as they get older, they lose their vision completely. So glaucoma, you might have heard of it, narrow angle or open angle. That little V there is just the angle. So open angle means open angle. Close angle, narrow angle means narrow angle. Narrow angle tends to be very painful because there's a build-up of fluid in the eye and you tend to come in. But the open angle, there's absolutely no pain. So I think this is the final slide in terms of eye disease. So in ophthalmology, we either see you in clinic as an outpatient appointment, or we do surgery, different types of surgeries. So squints, oculoplastic, glaucoma surgery. Either way, it's quite important that you are seen. We have moved to a lot of virtual clinics these days. So at Moorfields, we tend to see you on the computer, diagnose you and treat you, or send you to your opticians, or send you to your pharmacy to get a prescription. Or you can come in to the A&E if you think you're serious enough. So if for some reason you've been triaged to go to a virtual clinic, don't think it's because we don't think you're important. It's just how COVID has changed the way we do things. And ophthalmology now is I think it's the 3rd or 4th year running, we're the highest used outpatient service there is in the NHS. About 7 million appointments per year. Cool. So a bit about research. I'm a researcher. Go ahead. Have you taken it to see someone?
I have taken it. They said they've got to put a drop.
Yeah.
And then I've got to go with that.
Yeah. So with kids and lazy eyes, they do two things related. One's called patching, which is a drop. So patches is literally putting a patch over a child's eye. So in the olden days, you used to put a proper pirate's patch. And then it's moved on to putting plasters. And that's all about getting the eye, they patch the good eye to get the lazy eye to start working properly. But the drops is like another advancement, what they're doing, because kids used to get teased for having the pirate patch and the other patch. So now they dilate the good eye. So you can't see, so the other eye needs to pick up the show. So that's different types of patching, but it's the same thing, to try and strengthen the lazy eye. So, yeah, I'm a researcher, can't go away without doing research. How many of us know about research? Or, okay, first I should ask, what's the first thing you think about when you hear the word research? What? Next. Clinical trial, yes. Come on, be honest. Tell me, what do you think about when you hear the word research? Yes. Yeah. What
You
else?
have to take your time and go through the paperwork.
Yeah. What else? Why are you guys on saying things like guinea pigs? Come on. I won't be offended. Yeah. I don't, but people do. Right. Yeah, sweetie. Yeah. Good.
One more.
Trial and error.
Yes, why not? Why not? So, how important is your sight? There's a study in America in 2016 asking about 2,000 people if you had the option to either have HIV, AIDS, blindness, cancer, or dementia, which one would you choose not to have? Yeah. Almost all of them chose blindness. And that's to tell you how important people value their sight. Now, we've done lots of research at Moorfields in terms of eye vision. We have a microchip that brings people see properly after surgery. People who've lost their eye completely, we wouldn't think about it, but having a false eye and how it looks is very important to people's well-being. Now, why is diversity in research important? It's there, you can see it, so I'll just talk through. Kidney disease is very prevalent in black people, yes? However, 97% of the people in kidney trials are white. How does that work? Kidney disease prevalent in black people. 97% of people in kidney trials or medication are white.
You bother about it?
Yeah, but shouldn't we be there because it affects us more?
Yeah, sure.
So how are you wanting to work for you if you're not there? Yeah, I'll agree with that, because when I was training, I trained in Surrey, only on white people. Went to Sheffield, got my first black patient, didn't know what to do with him. I confessed. So now they're talking about decolonizing the curriculum, and there's a big move to doing that, so we're working on that. Show up. I'll go through that. So more evidence. Went to a conference in New Orleans, I think in March, April, and it was quite staggering. Because most of the tests done on people for cystic fibrosis as a lung condition is also based on white data. Most of the tests done for people with COPD, so another lung condition, is also based on white data. So therefore, if we go in with the symptoms, we don't get picked up on a screening test because it's not targeted to us. It's not deliberate, we're just not there. If you're not there, how is it going to show you up? I don't think so. Maybe in the past,
Hasn't changed much since then.
but okay, let's think about the COVID trials. Did you show up for the COVID trials?
Hell no.
So forget in the past, let's look now. So we got COVID data back. And again, the white people were lining up outside the door for the COVID trials. And the black people, who it was killing us in droves, were we there? Yes. Yeah, I know there's a lot of history on the ethics and stuff, but things have changed. When I was doing my PhD, an elderly black Jamaican woman threw her slipper at me because I was a sellout. Answer yourself that question. Yeah, because she was afraid. Because like, you know, I was a sellout. Why are you coming to take my blood? Because she was afraid that her blood will then be given to the police. Then it will then affect her grandson who was involved in illegal activities. But that's a valid fear. But medical ethics have come along so much these days that the researcher can get jailed for proper time for breaking rules. And it's not only the researcher and the hospital that can, say, self-monitor. Everything is now monitored externally by government, other institutions. So yes, I know there's a lot of things that may go wrong, that still go wrong. I'm not going to say everything is perfect, but we've come a long way from where we were. Something else, I was talking about the COVID trials. In the COVID trials, again, there were more white people. In England, there's about, say, 6% of the population is black. Only 3% of the COVID trials population was black. The Indians is 8%, only 4% of Asians went in there. And then we complain about the symptoms or the side effects of the vaccine. How do you want it to work on us if we're not there? I know we are afraid, but we can take small steps into giving our data. I'll show you something else just now. Go ahead.
Yeah, I was going to say, I think you touched on the first point. So I don't know how they're going to address that in this country because, as you said, I thought it was 4%, but you said it's 6%. We're only 6% of the population in this country, and in whole areas there are no white people. But you will find even in the deepest shurs an Asian or Turkish, but you will not find a black person. So that's one thing that maybe is a disadvantage to us because we're not all over the country. And the second thing is as well, because we're not all over the country, research is limited on us, as you're saying, because with the COVID, how deep do they go? If you go in hospital in the day, the majority of the staff are white. Night shift, the black people come in. And what should we be doing at night? Sleeping. So we're not sleeping, so the cells are not being repaired. So how do you shift that paradigm, you know? Because that's just the way it is.
There's lots of research on shift workers and changing patterns. Yeah, because there are lots of diseases, diabetes, hypertension, everything happens at shift. Yeah. Yeah, yeah.
I'm just wondering if it's an attitude sort of situation, because of course you said a lot of whites go to get themselves, you know, volunteer tested. Is it an involuntary for just blacks, Asians, that, or we can't really trust them, we're not too sure of them? How is there a way to strengthen that relationship between, you know, the blacks to, you know, the general population of today in this country?
Yeah, talking my language. So one other point on diversity. So it's not just about attitude, it's also about genetics. The metabolism of drugs in your liver is different between different races. So again, how do you want it to work on us? Different cultures. So some people take homeopathic remedies. if they take it as well as Western medicine, it can actually change the way things work. So I'll just skip this slide. This is not working. Ooh. Okay, it's not working. What I was going to show, there was this big landmark study where they gave millions of pounds to collecting people's data called the UK Biobank study. And again, same populations, white versus black. And now all the studies, 97% of the studies that they're doing from that database is white data. So they're making lots of advance on glaucoma, diabetes, everything, but in white population and there's no black. This one is even more important. Now, how do we get credit cards? You apply for it, but what goes on behind? Do you think it's a person actually looking through your application, or do you think it's an AI system looking through your application? AI, right. So the AI will say if you live in a certain area or a good postcode or you have a certain income, and all these different factors will say whether you have a credit card or not, right? But that's based on and white data. So therefore, if you live in deepest, darkest Hackney, you are less likely to have a credit card because they don't recognize your postcode as being a good postcode than everything else. Yes, we understand that system. It happens. Look at data. On the internet, every day, 5,000 gigs of data is about black people. And 117,000 gigs of data is on white people. There isn't. There isn't. Black people are called the global majority. Think about the entire continent of Africa. Think about African Americans. Global majority. But yet, less of our data is going into all these AI systems. So what's coming out about us? But how are you going to do personalized medicine? Yeah, it's a choice you have to make, but I'm just giving you the facts. I'm not persuading you to do anything. I'm just presenting facts. That's my job. And you decide how you want to play it. Yeah.
Throw it out, general. So I'm wondering, with all of these findings that you're now telling us, you probably can't answer the question, but anyhow, yes. Would there or could there be a group, a forum, an association, an organization that could now investigate and invest in just having research with the black ethnicity? I mean, everything seems to be so generalized. And then it come down to the bottom of the list, you realize, well, you're always in the minority, even if it's a global majority.
Yeah. So there's this study on sickle cell coming to Moorfields, which is being run by a lady from Ghana, specifically for black people. Okay. There's another organization called Inspire. I went to their launch Friday night. Yeah. Again, they were given money from the government to be national. And they're doing different events online talking about eye health, different things. So that's just education, but they're also doing research in different boroughs on not just eyes, gambling, because apparently it's quite high in black people as well, high blood pressure, mental health, kidney disease, and they're running stuff. It's Inspire. Look online.
Yeah, but that's good to hear. But I think that we probably need to step up with a more motivation on the black ethnicity to get involved.
Yeah. So I created this platform in 2021 and it won the Nursing Time National Awards. And this is doing what you guys have asked. This is putting the data out there for you to look for yourself and decide whether you want to be involved or not. So on this website, the website is there, and I think I'll leave it for you, Sister Melvina, to share after. You can literally go on and see what research is being done in the organization, have a look at the synopsis of the study, so a little summary, and then you can ask to be contacted for more information. Not to sign up to be involved in the study or to participate, but to get more information to make your choice. And that's not been available before. Question?
Yeah, I will reach the question. One of the reasons blacks don't go forward with research is because of the way the world, whoever has implemented a worldly system that is against blacks, and that is from black history, right? Back in the day in America when they did a research on syphilis,
Tuskegee study, yep,
Yeah.
very aware of it.
blacks went forward and they did not benefit from the research.
Understood.
Yeah?
Yep.
So based on that, that is why they don't trust the worldly system.
Completely understand. But that
Yeah.
was 40 years ago, and the ethics has changed.
Not much has changed. And history will repeat itself. Unfortunately, blacks go through this.
Yeah, understood. But what I'm saying
But-
is the information is there for Tuskegee's time. They pulled the wool over our eyes. They said they were giving us vaccinations for syphilis, yet they were actually giving people syphilis, and they wanted to look at the natural history of the condition. So they were letting the men infect their wives, come forward for more vaccination, reinfect the wives, look at how it passed on to the kids, look at how it passed on onto late life and to senile dementia due to syphilis. Completely aware of that. However, now we are giving the information for the person to be able to make their own decision. It's no longer cloak and dagger. So there is no way I'm going to say to you, go and line up for any particular study, because I don't know what's behind it. What I do know is that the information is there for you to decide when it wasn't there before. And all I'm asking is that you actually read the information, not just say, I don't want research. Is that?
Right. So blacks are interested in research, just that the trust is not there.
Mhm.
Whether they will benefit or what is it else
Yep.
that they might be up to, and even recent incidents have proven that.
Yes.
Yeah.
So in the patient information sheet that you have to read before you consent to a trial, they've changed it recently to say what are the risks, what are the benefits, who is the legal party for any insurance, all that is listed there. And as I said, it's there for you to read. If you want to participate, fine and good. If you don't want to, if you want more information, you can discuss it with the researcher. But it's no longer cloak and dagger putting it over your eye. I do know that things do go on under the radar. I'm not going to say it doesn't, because I sit on different research committees nationally, and I know we have to do lots of pulling up of people's socks a lot of the time. But now there's a lot more information for us to make an informed decision than there was before.
And just to add to what you have said, is that 40 years ago, I don't think there were as many black people then, if I just use that flatly. I don't think enough black people then had the information, the education, and the opportunity to help our race. But 40 years now on, there are so many black people that's in the higher echelons that is able to hear and see what's going on. And if they're brave and bold enough, they could speak out, as you just said. Sometimes you really need to pull some socks up. So I think we are on a better footing, and the trust should be better than back then.
Yeah, there's no way you can elicit somebody's trust just based on what's going on and hearsay. They need to make the decision themselves, and that's all I'm advocating for, and that's why I created this website. The ball is in your court. There is no way I'm going to say, string arm you, or, strong arm you into coming or anything of the sort. But we just need to know that I am being transparent and putting this research out there. If you want to participate, you can do. But don't feel as though, and there's something else. Some groups I went to speak to, people always say they've never been approached. They didn't think their voice mattered. So there are three parts of research. There's either getting involved in the actual clinical trials, which people probably don't want to get involved in. Absolutely fine with that. But there's also a bit about involvement, where you can shape what research is being done. For example, this trial on sickle cell, it's because patients said to us, nothing's being done to us. We're just being left to go blind. What can you do? And because a patient came to us, we then created this national trial, first in the country ever, to now investigate sickle cell disease in the eye. So your voice does matter. So there are different parts of research. If you don't want to do the clinical trials, absolutely fine. But please help us shape what we do going forward. I think that's it. I think I've preached. Yeah, so there's some flyers on this. Take it, have a look, see what you want to do, and that's it for me. No questions? Brilliant. Love you. Have a blessed day. So on the table, I've got some simulation, like lots of leaflets, but also simulation glasses. So this one tells you what a patient sees if they've got a stroke. This one looks at a patient who's got cataract. This one talks about a patient who's got that AMD thing I talked about, macular degeneration. This one is a person with really dense cataract, and then this one is a person with glaucoma. So if you want to come and have a look, very welcome to.
It's open. We have seen, we have heard. We have heard, we haven't seen it. We have, we have heard. Now we can experience. So we're still in the church. We can do this orderly. And you could come up. Afterwards, you can take some leaflets. But have a look. Try them on. See what you can see. Let us be orderly.